is tired of waiting endless hours in the emergency department?
Did you know that each year 16 million Canadians go to the emergency department? In Ontario, you can spend an average of 5.2 hours in emerge for a complex condition and 2.2 hours for a non-urgent problem like an earache or sore throat.
These long wait times often result in critical patients developing additional health concerns for not receiving timely care. It is expected that when a patient is triaged as urgent in the emergency department, they will receive care within the first 30 minutes. However, in Canada, these patients are waiting up to 4 hours.
So why does this happen? Why are wait times so long? This is a wicked problem.
What's a wicked problem?
A wicked problem is a social or cultural problem that is difficult to solve because of its interconnectedness with other issues. These problems may have incomplete or contradictory knowledge, too many people or opinions involved, or maybe a large economic burden.
Basically, it's a complex problem with no easy solution because so many factors are involved. So what does this mean for emergency departments?
Congestion. And why is there so much congestion? On average, 33% of Ontario patients wait up to 6 days for an appointment with their family health team. And when they can't get an appointment fast enough, they go to the emergency department. In fact, recent statistics show that 57% of emergency department visits are actually non-urgent. That means they could have gone to the family health team if they had been able to get in sooner. So what makes family health teams more accessible? Extended hours on evenings and weekends, more staff, and increased education about the alternatives to the emergency department. Many people think that the emergency department is the end-all and be-all, but it's not. There are many other options such as public health clinics and urgent care centers that can be utilized to optimize the health of patients.
Some patients are staying in the hospital for longer than they actually need to. People aren't being discharged home because A, they're unable to live on their own and there's no long-term care beds available, or B, there's not enough home care services. So they stay where they are until something else comes up. Take a walk to the subacute medicine unit, LHSC. Ask one of the nurses and they'll tell you that most of the patients staying there are elderly people, taking up valuable hospital beds, waiting for a nursing home. So what gets people discharged faster? More transitional beds, more long-term care facilities, and more home and community care services.
People with poor chronic disease management are often readmitted through the emergency department within 30 days of discharge. This is because sometimes people are discharged without the knowledge, skills, or resources to properly care for themselves and their chronic conditions while at home. Or patients are overloaded with information and often don't know how to manage the information or their illness. They are required to be their own advocates for their care while having to deal with their disease. Unfortunately, they do not have the confidence or resources to speak up for their needs. So what would help these people? Programs in the community such as the Geriatric Transitional Care Program, which reduces hospital readmission through education, self-management teaching, and follow-up phone calls. With proper health teaching and community supports, patients will develop a better understanding of their illness. Only then can these patients start to properly manage their illness and advocate for their own health and well-being.
We know that these issues are intertwined, which is what makes it such a wicked problem. An upstream approach that focuses on health promotion and prevention as the foundation for care is needed. 33% of people today have a chronic disease. Increasing disease management and education in the community will help to prevent emergency visits in the first place. The World Health Organization explains that proper nutrition, regular physical activity, and being stroke-free can prevent about 80% of premature heart disease, stroke, and type 2 diabetes, as well as 40% of cancer in Canada. It sounds great, but it's easier said than done. The current Canadian healthcare budget puts 30% towards hospitals and only about 5% to public health. A shift in these funds could support initiatives in the community that will prevent emergency visits.
The nursing profession is making it easier for people to make healthy choices. We're building better public health policies, creating healthy environments, increasing community engagement, and providing health teaching. Wicked problems are not easily solved, but it's up to everyone to work together to make a difference.